20 pounds in 20 days. My next guest says it can happen if you reduce 3 things in your diet, but if you want to keep the weight off, it needs to be a lifestyle change. Please welcome back cardiologist Dr. Kota Reddy.
Thank you for having me here.
All right, before we get to that, we have one of our audience members who had a question for you.
Deborah, hi, Dr.
Hi.
Reddy. I have a question. My question is, I woke up one morning with vertigo and palpitation of the heart, and I want to know what causes that.
Okay. What you're describing is vertigo. Anytime you say vertigo, you feel like the whole room is spinning. So if that happens, there are only 2 usual causes. One, if you had a small stroke involving the back portion of the brain, that usually happens in the age group of 65 or 70. Or 2, if you have something to do with the inner ear. If that happens, if you feel nauseated and you feel like the whole room is spinning, the normal response is to have palpitations. So it is not the palpitations causing it. Sometimes you can have palpitations caused because of atrial fibrillation, irregular heartbeat. When that happens, you could have a small stroke going to the back of the brain. That can cause precipitate vertigo. So you have to be careful. Anytime you feel like the whole room is spinning, ask a question. Is it the brain? Is it the inner ear? Go see the ENT, go see the neurologist. If the ENT says everything's fine, make sure you didn't have a stroke. Does that answer your question?
Yeah, very interesting.
Thank you.
Okay, now speaking of answering questions, the point of eliminating 3 things in particular from our diet, or at least greatly reducing them out of our diet, can help you lose weight, but it also, more importantly, makes you healthier because it can save your heart.
Let me tell you a story. Last time when I was here, a lady who watched the show came to my office. So she was around 56 years old. She was on 11 medications. She came to the office, she read all the charts in my room, and she said, today I'm going to give up 3 S's, salt, sugar, starch. And that's it. I forgot about it. 21 days later, she comes back. She lost 20 pounds.
Wow.
Without exercise.
Wow.
And dropped all her medications, including insulin and 2 medications for diabetes, including 3 medications for blood pressure and cholesterol. And her blood pressure in the office was 120 or 80 off medication. Her fasting blood sugar was 90. What does it tell you? She is saving a lot of money by just giving up what? Sugar, starch, and salt.
And besides saving a lot of money, she's saving her life.
She's saving her life.
Because, you know, what it tells us almost is that nature's medicine is food, and we do food correctly. That's what can help us avoid so many other problems. If she was taking 11 medications, and now she's not, just by adjusting her diet.
And that's within 21 days. What does it tell you? Can you imagine how much money you can save by just giving up salt, sugar, and starch? What is the cheapest item in a store? Salt, sugar, and bad fat, and starch. Well, if you give that up, what happens? You save a lot of money. So I usually joke, if you enter the kingdom of salt, you will end up paying taxes in the form of medications you pay to the pharmaceutical companies and hospitals.
Yeah. Okay, I'm going to ask you what else is left if we give up sugar, salt, and starch, but we'll get to that in a second. Let's talk about what these things do in your body, especially, are you saying give it up completely or greatly reduce?
Greatly reduce.
Okay. All right, so salt. We know that we need salt or sodium in our bodies, but we kind of overload on it.
Okay, let's look at it this way. Holidays are coming. What happens? When holidays are coming, what are we going to do? We're going to eat. We're going to eat what? Salt, sugar, and bad fat. When we do that, what are we doing? Putting ourselves at risk for heart attacks. Now, imagine you heard of Tim Russell. Tim Russell had a stress test. 6 weeks later, he goes to Italy. 1 week, comes back, flies into New York, goes into his boardroom, drops dead of a massive heart attack at age 50 when his dad, 84, was still alive.
Yeah.
So what does it tell you? Well, what could have happened? Simple. If you consume a lot of salt, what does it do? It makes you retain a lot of fluid. When it retains a lot of fluid, your blood pressure goes up. It puts you at high risk for high blood pressure and strokes. That's one. It also puts you at risk for heart failure because it starts to make you to retain fluid in your lungs. Second, when you consume a lot of sugar and alcohol, what happens? It puts you at high risk for elevating your triglycerides. When your triglycerides go up, you're at high risk for pancreatitis. And 2, if you consume a lot of alcohol, it does the same thing. Elevates your triglycerides and puts you at risk for pancreatitis. It also causes holiday heart, where you have atrial fibrillation, abnormal rhythm, which makes your heart rate go fast. Also puts you at risk for stroke. Then comes the saturated fat. That's bad fat. When you consume a lot of bad fat, especially during holidays, what are desserts, what are pies? All of them are made from sugar and bad fat. When you consume these, for the next 3 to 5 hours, you are at the highest risk for having strokes and heart attacks. Fourth is, of course, during holidays, what do? Smoking. When you smoke a lot, you're also doing the same thing. You're making the blood sticky, thick, and more prone to form clots. When your blood pressure goes up, you're also at risk for plaque rupture and heart attack. Same thing happens with stress. Holidays and stress.
Yeah, so you put all that together, and our bodies are in this constant state of trying to fight, and then eventually parts will give out, and that's when we see the big heart attacks.
Now I have a picture which shows us a holiday heart calendar. So when you look at the calendar, what does it show? So now, as I said, there are 6 sins to avoid: salt, sugar, starch, saturated fat, smoking, stress, spirits. Gluttony is a sin. Now, there's another one which shows about the holiday calendar. Now, oh, this is about a gentleman. This gentleman came to my office. His cholesterol numbers were perfect. He had no abnormalities. Good cholesterol was very high. Yet, when I did the blood work to see if there's any inflammation in his arteries, what do you see? Myeloperoxidase, it's very high. LP-PRO2 is very specific for inflammation in the arteries and the plaque. It was very high. CRP was very high. This is another test which I started doing in my office called isoprostane. It tells you how much oxidative damage you're doing to your body, and that's extremely high. Based on these numbers, this patient is at the highest risk for having strokes and heart attacks in the next few weeks, in spite of being on medication, in spite of being on all the perfect cholesterol numbers.
And that's the cool thing. When you go to his office, it's one of the things you can do. You can look inside our arteries and see if there is plaque formed already, and see at what level you might be at for having a heart attack.
There you go. So 40% of our heart attacks happen in the last 2 weeks of December and first 2 weeks of January. Why? The same thing. Gluttony is a sin. Look at the plaque formation. Plaque cracks, close the artery, gives you a heart attack. Thanksgiving, it starts with Halloween, Thanksgiving, Christmas, and New Year's. Most number of heart attacks happen on December 25th, followed by 26th and January 1st. Ask yourself why. Sugar, starch, bad fat combined in the form of dessert.
It's the straw that breaks the camel's back, so to speak.
That's correct.
All right. Okay, so what can we eat is what I want to know.
Reddy diet.
Yeah,
no, no, you can't eat everything. So you want to go on a party, go ahead, have a big meal, but don't do that every day. So on Thanksgiving Day, if you have a big meal, the next 1 day, 2 days, don't eat too much. In moderation. So
we know what it looks like. Real whole foods, real vegetables, fresh vegetables and things like that. Low fat, very lean meats, and smaller portions of meats. We kind of fill our whole plate with it as opposed to just...
Simple, 80-20. Go lean, go green. 80% of what you eat is green, and 20% of what you eat is lean meat. How can you go wrong?
All right. Thank you very much, Dr. Reddy.
Thank you.
For more information on nutrition and keeping your heart healthy, call Reddy Cardiac Wellness at 281-491-0044, 281-491-0044. He also has this thing called Reddy bread, that if you're a carb freak, you take this Reddy bread, you eat that bread, and it kind of reduces your craving for carbs.
A lot of patients have lost weight on the Reddy bread. And diabetes.
Yeah. All right. Visit them also on the web at reddycardiology.com. Reddy is spelled R-E-D-D-Y. Reddybread.com also is where you can go. After the break, we want to tell you about a program for overweight kids. This is all about teaching good habits early so kids can stay healthy for life.